Now, doctors who care for pregnant women say abortion laws are already impacting their offices.
Some worry that stricter laws would mean fewer top-quality doctors will choose to practice here in North Carolina. CBS 17's Maggie Newland is here with us tonight, continuing our team coverage. And Maggie, what are these doctors seeing?
Rod and Angela, I spoke with a local OBGYN and a researcher who's studying the impact of some of the country's strictest abortion bans. They say those bans could ultimately affect access to all kinds of pregnancy and reproductive health care.
Dr. Beverly Gray is an OBGYN with Duke Health. She delivers babies, provides pregnancy care and annual exams. She also provides abortions. Since North Carolina put a 12-week ban in place, she says patients often come in for abortions but can't get them.
We turn people away every week. And sometimes it's, people don't always understand what the laws are in North Carolina. Sometimes people come in and they're further along in their pregnancy than they realize.
She worries about those patients.
We know that, women of color are 3 times more likely to die in pregnancy in this country.
Researchers are studying the effects of abortion bans on doctors. Meryl Bookbinder is the vice chair of UNC's Department of Social Medicine. She interviewed OBGYNs in states with stricter abortion bans than North Carolina.
In many cases, they were being forced to decide between providing what they thought was really a life-saving treatment and following state law.
She says many of the doctors reported depression or anxiety.
These bans really affect all OBGYNs. An ectopic pregnancy, uncontrolled hemorrhaging that occurs before the fetus is viable, miscarriage, all of these conditions need the very same abortion procedures that are done in abortion clinics.
She says some of the doctors she interviewed left the states where they were living or planned to leave. Gray worries if a stricter ban goes into effect in North Carolina, some doctors who study here will decide not to stay.
I think the greater concern is whether or not we're able to attract the best and the brightest in North Carolina.
She says when people are considering studying obstetrics and gynecology here, a lot of times one of the first questions they ask is about North Carolina's abortion laws. In the studio, Maggie Newland, CBS 17 News.
All right, Maggie, thank you so much.